Hi, I'm Jessie, a women's health nurse practitioner who specializes in fertility. Today, I'd like to talk a little bit about trying to conceive with pre-existing diabetes. Now, this is diabetes prior to pregnancy, type 1 or type 2. Many women with diabetes type 1 or type 2 can successfully achieve pregnancy and have healthy pregnancies, but they do face some unique challenges that I'd like to discuss today. I hope that after these videos, we'll have a better understanding of proper diabetic management before pregnancy and during pregnancy, and that by taking some of these proactive steps and seeking guidance from a healthcare professional, we can increase our chances of having a healthy pregnancy. If you are a diabetic and thinking about having a baby or actively trying to conceive, it's very important to review your current medicines with your prescriber. There are some common medications taken by diabetics that really aren't considered safe in pregnancy, and some even need to be stopped a couple of months prior to trying to conceive. Now, I do not recommend stopping any medicine without reviewing that with your healthcare provider. Sometimes some alternative medicines can be started, but it's just very important to review those prior to trying to conceive. Also would suggest taking a prenatal vitamin with adequate amounts of folic acid. Preconception planning is the foundation for a successful outcome in women with diabetes, both type 1 and type 2. So, if you're a diabetic and you're thinking about having a baby or actively trying to conceive, it's very, very important that you set up a preconception counseling session, either with your obstetrician or with your fertility specialist or even your endocrinologist. It just is important to have this visit to discuss risks of diabetes and pregnancy. That is not to scare you, not by any means, but it's important that you understand the importance of good blood sugar control. We know that that's not easy, and so that often requires frequent monitoring and frequent appointments. It's also important to review those medications and make adjustments as needed. Diet and exercise, current habits are reviewed and suggestions may be made, along with weight management. Just really, it's important to have a good baseline evaluation of your eyes and your kidneys and your blood pressure and your thyroid, just because some complications may need to be treated prior to pregnancy. Overall, that preconception visit is really just going to optimize our chances of having a healthy pregnancy for both mom and baby. Both type 1 and type 2 diabetes carry significantly increased risk for complications for both mom and baby during pregnancy. We see an increased risk of congenital malformations, so birth defects, mostly seen in the heart and the central nervous system, so the brain and the spinal cord. Those organs all form in the first trimester, and poorly controlled blood sugars increase risk for malformations while those organs are forming. We also see increased risk for early pregnancy loss, preterm delivery, preeclampsia, large birth weight, and even fetal demise. And all of those complications are largely associated with poorly controlled blood sugars. But the good news is that studies continually show that blood sugars that are well controlled significantly reduce the risk of complications for pregnancy, showing that we can have healthy pregnancies, when facing diabetes, as long as those blood sugars are controlled prior to pregnancy and throughout the pregnancy. So it's very important to seek guidance from your healthcare professional and take whatever measures we need to control those blood sugars and optimize our outcomes. Coping with diabetes and the additional challenges of pregnancy can be emotionally taxing. The medical and lifestyle regimens that must be undertaken are intense and can have significant impact on your psychosocial well-being. I strongly encourage you to seek help from your healthcare provider, friends, family, support groups, or other mental health resources as you need. You are not alone. There are many resources available to help you along this journey. Coping with diabetes and the additional challenges of pregnancy can be emotionally taxing. The medical and lifestyle regimens that must be undertaken are intense and can have significant impact on your psychosocial well-being. I strongly encourage you to seek help from your healthcare provider, friends, family, support groups, or other mental health resources as you need. You are not alone. There are many resources available to help you along this journey.